Yeah. So the thing is that I'm happy to train young people because I think they're the future church of tomorrow. When we can train them properly and they can be very effective, it'll be an excellent.
I know what is going on.
So she's doing very well. I have to admit it. She's doing exceptionally well.
I have a question.
Yeah.
You want me to do everybody's blood pressure?
No, just one person.
Oh. Sorry, I thought you wanted me to do everything. I was like,
You would have.
we have so many blood pressure coach right here.
You would have a heart attack if I did that to you, right?
Okay, go ahead.
So the lady that's coming up with the urine sample.
Maybe she couldn't go.
It don't gotta look pretty.
The well went dry.
It's not supposed to look pretty.
Oh, I got a question in the meantime.
Is something wrong? It should be up already.
Why squeeze it out? Why is urine yellow?
Why? Because of all the food, the medication, the dead cells that's coming out of our
Well, let's
body.
say if I had chocolate, right?
Yeah.
And I had,
I know what's going on.
and Pepsi or whatever the case is, how does it transform from that color to
Because
yellow?
the kidneys have filters. It's a filter. So the kidneys filter that stuff out.
And then it comes out yellow.
Yeah, we think you have to be shocked to
Wait,
that's good.
come bring it. I can't see it. Oh, you went downstairs.
Yeah, I thought she went over there.
Yeah, I was looking on
All right, so let me take a look at you.
Doc.
And then you sit right here.
Hey.
Okay. Let me show you urine.
Nice talk.
You sit.
Sit.
All right, so
Don't be afraid.
now the color of the urine, if I was to say to you, what color would you see?
Make sure it's closed.
It's close.
Like yellow. Clear, come closer, clear. Close to it, but get yellow. The tank.
All right. Should she be drinking more water?
Yes.
Absolutely.
Yeah.
She's water short.
Hey.
Short on water. So that means that she wasn't drinking enough water throughout the day, and so it's this color. It's okay. It's okay. It's okay. But she needs to drink more water. Okay. Now the saliva. It's pretty clean. You should be able to see right through that saliva. If you have a lot of phlegm in it, that means that she's not drinking enough water, or she has a lot of mucus in the build up in the body. Okay, so that's what we do.
Oh, the frothy one.
All right, so yeah, don't sit down. Just sit there. I mean, don't sit down. Sit there.
Don't sit down.
Okay, but I want the group to see. So sit on the other side.
No, they're sitting out there now.
Good.
Okay. Because she stepped on the thing.
Oh, sorry.
All right. You don't want to be seen.
So while the dust is checking this out, let's look at the second form that I gave you. This is the sheet that we call it the consultation sheet. And so if you look at this, yes, this consultation sheet. Now, if you follow right across, because everyone's going to be doing this, you're going to be doing this to each other. So, what's the first going? So, you write the date the time that you're going to be testing a person. Then you're going to start with the right hand, take the blood pressure on the right hand. Then you're going to take it on the left hand. You're going to take it laying down. And you're going to take it standing up. There's a reason why I want to do 4 different ways. Okay, now how many people have their equipment? I know Jimmy has it. You have your blood pressure cuff. Good, good.
Yeah, one.
You have it. Okay. Excellent. Okay, so and then next thing you're going to do, you're going to take your to make sure you get your pulse. Then you're going to do the respiratory. Now, I'm going to tell you how we do the respiratory. The respiratory is how often the person breathes in and out. All right. Now, usually when I tell a person, I never tell a person when I'm checking their respiratory, because if I say I'm going to check the respiratory now, they'll never breathe right. They're going to hold their breath, or sometimes they'll let it out, hold it, and especially if I'm looking at their stomach to see how often they're breathing in and out. So whenever they're not expecting it, which is they are going to expect it, no matter what you're going to do, you try to get your respiratory. Next thing is laying down, standing up. So person's lay down, stand up, take the blood pressure. The next thing they're going to do is their temperature. Now I have a thermometer there, and you just never point it to the frontal lobe, point it to the side of the neck. Okay. Some people like to do it on right here, but I'd like to do it right close to the brain. Then you're going to do, well, you don't have 4 cups. So forget the saliva and urine. I'll show that the next time we come. But I want to show you this to your sister. So what we're doing. Then you're going to do a breath hold. How long you can hold your breath. Now, watch what I'm doing. I want you to breathe in like this and breathe out. In through the nose, out through the mouth. You do that twice. And then breathe out. And then the third one, I want you to breathe in. And you hold your nose for as long as you can without opening your mouth. Okay, we're going to do all of those with her. You don't have to do it yet, my sister. Then we're going to get their, we're not going to do the glucose today, we'll do that next time. Then we're going to take their weight and their height. And you're also going to take their BMI. What's the BMI? Step up. Could you pass me that BMI? Yeah. This is a BMI. You're going to take their height and their weight, put that information in. Okay. And then once you put the information in, then and their sex, then you're going to have them hold it like this. Your palm should be touching the metal plates here on both sides. Thumb goes on top, and you're going to be doing just like that. Okay, with thumbs on top, but your palms must be touching the metal plates. Okay, so and then you can press start, and it will give you the reading of your body mass and body fat. Yes.
Question: does that also go with children as well?
Yes. Okay. Yeah. As long as you're over 12 or something.
12 or over.
You just made it. All right, so that's it.
But Jared, when you said that, if you were a bigger 12.
Yeah, it could be heavy set, small, it doesn't matter.
But if you were 11, what happens if you were 11 and you were big for your size?
I could get away with it.
Okay.
I could get away with it. Then we do the oximeter. You know what the finger oximeter is? All right, does everybody have an oximeter? Can you hold it up, please? All right, excellent. Well, I'm so proud of you folks. Very good. And then you're going to take a stethoscope and you're going to listen to the heart. What side should you put the stethoscope, on the right or the left? On the left, right? And you should be telling them exactly how the heart is beating. Okay, so I'm going to come around and I want to make sure you got to write down what you're hearing. Then I want to describe what you're hearing. Is it beating like this? Boom, 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 boom. Or is it being boom, 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 boom? So that's. I want you to describe what you're hearing on in the description section. All right. So that's what we're going to do. All right. Any questions on what I just said? Any
What
questions?
you were saying is we have to put that on this sheet?
You just check off what your health issues are.
Okay, but with the telescope and the.
No, you have another sheet for that, which is this one. That's
Yeah,
good.
that's the scope. That's the scope.
Yeah, put it down. Yeah. Okay. So, all right. So Hadassah's going to do her. Well, did you do the urine saliva one?
Yeah, it goes up to 10.
Hmm?
It goes up to 10.
10.
the
Okay. I
youngest.
thought it was 12. So, all right. So she's going to pray with her. Always pray with the client that you're working with first. All right. So pray with her, and then you take her.
Dear Heavenly Father, thank you for another day. I want to pray that as we proceed to start vitals with Rhonda, that you continue to be with us and be with the numbers that are given to us so that we can be able to explain it. In Christ's name I pray. Amen.
Amen.
So I technically already took her urine and saliva already. So I'll just go with the results of it. So the results of her bricks, which is this little tool right here. And oh yeah, let me come in front of you so you can see too. So the bricks basically touches how much glucose is in the blood. So not in the urine, sorry. And it's supposed to be between 3 and 4. Hers was 3.
That's the normal.
The normal is between 3 and 4. Hers was a 3, so that means that your glucose in your urine is good. And then I don't know if we can write the pH scale, but
Well,
you're gonna draw it up? Okay, cool. All right, so for the pH scale, we all know what that looks like. Okay, so 7 is in the middle because 7 is neutral. Anything above 7 is alkalinic. Anything below 7 is acidic. Now your urine should be in the acidic range because your body is getting rid of toxins. So her urine was 5.45, which is good. So you're in the normal range as you should be. The next thing is your saliva. It should be in the alkalinic range because it's the part that helps to get everything ready for your stomach and your mouth. And hers was 7.45. That is also really good. Now, how did you sleep last night?
Not on the back.
On hold. You slept good last night? And it shows in her urine.
This morning.
Oh, this morning. Okay, she slept this morning. She was good last night. She went to bed at 2 in the morning. So, and your urine and your saliva, it should always be, for the saliva should always be in the alkalinic range, and your urine should always be in the acidic range. That is showing that your body's making the exchange at night. So therefore, when you look at someone's urine and saliva, you should be able to tell if they had a good sleep last night. That's why I asked her, how did you sleep? With some clients, the urine and saliva might both be in the acidic range. That means that they didn't get good, adequate rest. And that's how you do the urine and saliva. Oh wait, no, this is something.
So how would so that's how you determine whether the person get enough sleep based on the range of the test of the saliva and the urine?
The further it is apart, for example, what's her readings?
5.45 for the urine.
5.45.
And then saliva was 7.45.
7.45.
Yeah.
Okay. So the further these numbers are apart, the more sleep that she got, or the deeper her sleep. If her, we can tell that if this number was 5.45 and this is 6.34, what is this?
She got less sleep.
Is it, first of all, is this acidic? Yes or no?
You got to put
Yes.
acidic up top.
Yes. Out.
Put out.
Yeah.
So basically, from 1 to 7 is acidic. From 7 to 14 is alkaline. All right. So now, if both her numbers were in the acidic range, what was that telling me?
She didn't have enough adequate sleep because she could be sleeping, But if you're not in that deep sleep range, which is what
quality
Gary
sleep, yeah.
mentioned,
Yeah.
then that shows that you didn't get into that.
That is one thing that you can tell. Another thing you can tell is that they're not, their bodies is very acidic. Based on their urine, their body is very acidic, and so therefore, what she's setting herself up for disease, because the disease will thrive in an acidic condition or environment in the body. You really want, that's fine to stay acidic because that's what your urine is telling you, but your saliva should always be in the alkaline range. All right, so this is what we're looking at. So this is saliva. And this is your urine.
So the further part, so how the acidic, the more you descend down is more acidic. So if you're 3, you're more acidic than a 5
Yeah.
because it's closer to the
Now,
alkaline line.
between 7 and 6, it's 10-fold. It's not, you understand what I'm saying?
Mhm.
It's not just 1, it's 10. Then if it's between 7 and 5, it's 100.
So it's double.
Yes,
It's 10
double.
times more.
Yeah, so we know how acidic the body is. So the thing, and if it goes to a 4, it's right? It's even more acidic, and it's multiplying. All right, so that's what you're looking at. But what we're looking for, the normal human being, you don't normally see it. You see it maybe the lowest it gets is 4.5. That's the lowest it will go in the acidic range for a person that's in pretty decent shape. If it goes in the low below 4.5, they're in serious trouble. They're very sick. All right, but so we're looking for a range between 5 and I always say 5.0 to 6.5. That's the range I'm looking for in the acidic condition. For the saliva, I'm looking for 6.8 to 7.5. And as you can see, she's 7.45, and her alkaline urine is 5.45. So her body is doing pretty good as far as what's now. This is kind of a like this right now because what I'm just 8. All right. Normally I like to do this on a fasting when like before breakfast, before she eats anything. That's when I like to take it. Or she has to not eat at least 4 hours before coming to see me. I want everything out of the stomach, and she shouldn't have drank any water for at least 4 hours. All right, then I can basically tell her pretty much what's going on in the body. Okay, so go ahead for this.
Okay, the next thing that we check for after we get our urine and saliva pH and our Brix tool, which I showed you guys earlier about the glucose in the blood, sorry for saying that, is the consistency of the saliva. So we look at her saliva, we just like bring it out. So we want to make sure it's clear, or if it's clear, cloudy, or stringy. Hers is clear, but there's just food particles in it, so that's why it looks the way it is.
It was frothy before? Okay, so she said her saliva, what do you mean was frothy before? Just after you spat in it? Okay,
That means
so when it's frothy, that means that her body itself is acidic. You understand what I'm saying?
frothy.
It will give me an indication that, and she has a lot of bubbles in it. Yeah, it will. Her even her mouth may be alkaline. Her digestive system, her body is more in the acidic range. But right now we can't tell because she just ate and everything else. So she stirred up a lot of saliva, so it's going to be alkaline. That's what I'm saying. Yes. Somebody had to hand. Okay. Do you see how much you can just tell on just the urine alone and the saliva? You can tell a whole lot. And that's the beauty of it. Go ahead, Adessa.
Okay, then we continue on after we check the saliva.
Oh,
we go-
did you smell it?
Oh, I didn't gotta go to the urine. Smell saliva?
No, the urine.
Yeah. So we test the odor.
Oh, that's
the
gross, isn't it?
They'll be fun. So we test the odor, the color.
Why do you test the odor?
Okay, so I'll go into details one by one. So you test the odor to see if it's a raw odor, which is just regular urine smell. If it's strong, if it's weak or sweet. If it smells sweet, it's like diabetes, someone who's diabetic.
Sweet pungent smell.
Okay. Like just what Jerry said.
Sweet.
He's
Yeah, when
asking,
you-
how do you know how it
Oh, I
smells?
can't hear.
How do you know it smells sweet?
You smell it. You literally take the cup. Let me show you. You take the cup, you open it, and then you smell it. And
A
that's-
diabetic,
I think that what the question is, how do you, if diabetic or not, how do you describe an
Yeah.
odor? If it's sweet, that means it's a person who is diabetic and the urine, they're letting go a lot of sugar and sugar smells sweet. But how do you describe an odor?
Right.
Which is hard. Come in.
Like fruit is sweet, flower is sweet.
So that's the question is not only sweetness, come in. Not only sweetness, but how do you
Alright.
describe what an odor is?
all right, so when, all right. What is, when we're looking to describe a smell, you're gonna tell, when it comes out of the body, it's usually gonna have a raw odor. You know what do I mean by raw odor?
It ranks.
Huh?
It ranks.
Because what's a raw odor means that you're dispelling a toxic waste,
Right.
right? And it gives off an odor. So you have to describe that odor. The best way I will describe it, what I'm talking about, I'm sorry, right in the middle here. Best way to describe an odor, we've been doing for years, is I smell this. She at this point in time, she has a slightly raw odor. In other words, hardly any smell. Urine, when you go pee in the bathroom, if you smell urine as it's coming out, it's strong. That means you haven't drank enough water and it's very pungent. You can't miss it. Have you ever gone to a public bathroom?
Mercy.
You don't even want to go in. You want to turn around and go out. And the word you say is really strong, pungent odor.
Ammonia like.
Ammonia.
Oh,
like,
God,
exactly.
let it
If
die.
I
You know?
smell ammonia ammonia smell in your urine, I know that you are in serious trouble. There's a lot of people that goes in that bathroom and seriously, they don't drink water. And the point is, it just takes your breath away. All right, so the point is that you must drink the water, yes.
And it's okay if you eat something food like asparagus.
Asparagus is going to have the odor.
Yes.
If you take medication, you're going to smell the medication. Yes.
But sometimes when you take the medication, your urine is the color of the medication.
Correct. That is correct. And it has the odor too.
And sometimes you eat beef.
Right.
Under this
And
water
you-
is under this.
And it has a red color.
Water.
Yes. Yes, that is correct. Very good. That's what I'm talking about, being observant. When you observe these things, you're going to understand what you're looking for. I cannot tell you how to do it. You have to experience it. You understand what I'm saying? And you're going to pick it up very quick. Oh man, this is strong. Oh, urine. The baseline that I'm trying to tell you is the urine, when you urinate, should have little or no odor.
That's normal.
No, that's not normal. That's what you want. Most people, you'll smell the urine. Oh man, it's very strong.
So in turn, what's a healthy urine to smell like?
Little or no odor.
So that's why I use the term normal.
Yeah, but for most people, most people are not normal. You know, that's what I'm saying. Yes. Any other question?
And also, if you were to take onion, but iron things, the color changes too.
Oh, absolutely.
Oh.
Taking supplements, drugs, or medication.
Even beet juice.
Beet
change-
juice. You
change-
mentioned beets, yeah.
you think it pretty red.
Asparagus. It changes.
B complex, vitamins.
Yeah. Oh, yeah. Garlic, anything that has a strong pungent odor, you're going to smell it. And you're going to know basically what that person's been doing. All right. So it gives you an idea. And in fact, if you go to the Mayo Clinic right here in this great city of New York, they have a urine chart. And you can go online You can print it all out. It runs about this long, and it tells you what the colors mean. So you should write this down, do the research. Go to the Mayo Clinic and look at their urine chart. They have an actual urine chart. And they'll give you a description of what you'll be seeing. I'll go a little deeper than what they're giving you, but we've been doing this a long time. All right. Saliva, it should be a clear, fluidy liquid. It should have no bubbles. It should have no odor. All right. But it's thick and yellowish, whitish mucus, look like someone hacked it out. And I'll ask them, did you hack this out or did you spit this out? Most times they're gonna say, oh, I spat it out. They're in trouble. That means that disease is already setting up in their bodies. All right. That's all tells me they're not drinking enough water. So this is how you're going to tell just by doing a simple test like this. Yeah, there you go. Sure.
I don't know how.
Okay.
So that is what you're looking for, and this gives you an idea of where your urine should be. Yes.
You keep saying that you can tell when you're not drinking enough water.
Yes.
And to me, by you saying that, it seems like water can cure a lot, help people prevent a lot of diseases.
Absolutely.
Yeah.
That's why it's one of the laws of health.
Yeah.
If we're not drinking, you can listen. For example, if you're drinking adequate amount for your body size, in 1 month alone, you can lose 10 pounds. Just without, not even exercising.
If you're drinking water in a 2 months straight, in 1 month you can lose.
Without even exercising. I'm not advocating that. I'm saying exercise. But that's what it is. You'll have proper bowel movements. You'll have you'll be urinating properly. The kidneys will be in good shape. The prostate be in good shape for the men, and so on and so forth. As who did the water? Now, if you saw the chart, that's why I said I'm very interested. How does the organs function, and how much water does it have? For example, my heart should have about 80% water. My brain should be 85% water. My bones should be 60% water. Do you understand?
Yes.
Because most of our body is 70% of our body weight is water. So that's what I'm saying. And so when you're doing the urine saliva sample, we're actually seeing really if you're dehydrated or you're properly hydrated. And the people that have that chart, I don't need it because I know what to look for, and my lovely assistant is also knowing what to look for. So we know exactly what we need to see before, and we'll explain to the client what's going on. All right. Any other questions about this? Now she's going to do the other vitals. She's going to take her blood pressure. She's been sitting long enough, 5 minutes. Before you take anybody's blood pressure, they should be sitting down for at least 5 minutes. What do I say? 5 minutes. Okay. So Stephanie's gonna focus on her and this lady, and I'll explain. Remember, this is what you're gonna do after she does everything. Now we're pretty efficient. We can do the entire vitals in 20 minutes. Urine, sitting, laying, height, weight, you can do all of that in 20 minutes. All right, so I'm not saying you should do this, you're just going to be learning, but that's how efficient you should get about doing this. Listen to the heart. So that's it.
Oh, by the way, I'm just writing down. You always want to write down the date and exact time you're about to start the vitals. So that's what I'm doing right now.
By the way, I want you to critique her too. So.
So if you look on your sheet, the first thing you're going to see is the blood pressure. It's going to be the sitting down blood pressure with the pulse. So we're going to start off with her right side. And I'm going to get my cup here.
Yes, Anna, she did first. Because I left out of it.
So what you're going to do, and you're going to slide, because for the wrist one, you're going to slide it on. You're gonna make sure it's
Inner
tight.
on the inside, not the outside.
You're on the inner part, not the outer part. And what most people do is just leave it like this, but what Derek teaches us how to do it, you have to bend Their arm.
Slightly, yeah.
and hold it at least towards their hearts, so you get a more accurate reading. For people who are shaky, you might want to hold to them, but for the most part, it's not working. Yeah, sorry.
Try out the one that we always use. Yeah, that's it. I think that's it. You see that?
Just click on, you want to take the camera and
Yeah.
put it on the arm.
Okay.
With some things we don't get
You got it? Are you gonna? And you gonna relax a little? She
You can take it.
Given
You
muscles,
can
like-
take it. You can take it after she's done it. You can take it after she's done it.
All right, and then you're just gonna start, and you're gonna hold still. For most people, you might just want to give them a little extra support.
This one's a little slower than normal. So that's okay.
I pumped up twice. The blood pressures. All right, look at that number. What is she? Normal blood pressure.
Oh,
High.
okay, that's cool. You guys can see it on the screen.
Usually, when the meter pumps up twice, that means that she's automatically got high blood pressure. It's going to come out high blood pressure.
What do you mean by twice?
Oh, it actually went off twice. Like it pumped a little bit, then it
pumped
stopped.
And stop.
And then it went again.
Keeps pumping up again.
to pass the.
When you see that, then you know it's gonna be high.
And then you read out the number to them. So you got 186/90 as your blood pressure and your 70 pulse.
Write it down. And she can do the other one.
186.
It's about that.
Right. 186.
How come it
Oh,
only 86?
And then 70. So you're gonna do the same thing. You're gonna put it on the other side now.
How come it's so high?
Nervous. White coat syndrome.
No, Jimmy syndrome.
Yeah, no, that's fine.
Jimmy, she got your syndrome. It's contagious.
Yeah.
Relax. Is your arm fully relaxed? You sure? All right, so just bend it up. And we're gonna start it.
She should be calling, not us.
I think it's stopped.
On this side.
Excuse me. Can't do that. Gotta wait. You're trying to-
What?
Because you're expecting the people behind you. No, don't do that. They're
We're
trying to pay
waiting.
attention. Watch and wait.
I don't know.
When you work in an ambulance, you have to work. at
We're not in an
noise.
ambulance.
I don't know.
You work around your environment. So what was happening over here while she's getting that ready is Jimmy is asking why there's a drastic difference between one arm and the
That could be for everyone to hear. I
Right,
just,
so-
I don't want you to answer anything yet.
I got your hand. Oh, no, just.
Okay, now. Now. 120.
This is the one that you normally use.
This is
74. Same as the other.
pretty good.
Jimmy, could you hold your question?
I'm sorry.
Thank you.
Sorry.
So your blood pressure on your left side is, you just read out the numbers to them, is 171/87 with this 80, with a 75 pulse. Next thing you're gonna do, have her lay down. So you're gonna lay down. Yeah, that's this one. Then just lay down.
So move down.
You're gonna lay on your back.
Do not.
Don't cross your legs.
But now you're going to.
So what you do, you could just put them on them, but you're not gonna start it yet because you have to give her a minute to relax. And just relax. I'll start it in a couple seconds. In the meantime, I'm not gonna say what I'm doing until after I'm done doing what I'm doing. Oh, I'm sorry, I'm in front of the screen.
Just don't move in front of the camera. Move back over here, but not in front of the projector. Two questions.
You can now explain it.
Okay, let me do it.
Now she's going to explain something that you don't want the person to see what
Yeah.
you're doing.
So what I just did was I took her respiration rate. So when you're taking someone's respiration rate, you're not going to tell them that you're taking it. If I told her before, she would have been breathing like, like pretty much like that in that sense. And she would have been breathing a lot faster. I feel like it's easier for you to get someone's respiration rate when they're laying down because they're more calm, so they're not really paying attention. Usually most people close their eyes, like Jimmy over here sometimes closes his eyes to relax. So that's how you get their respiration rate. So what you do is that you put a timer on, well, not a timer, your stopwatch on your phone, and you go for 15 seconds, counting how many times they're breathing. So what I do is, before I even
Explain
start,
that at 15 seconds.
I'll do that.
No, explain it.
Okay, so you're gonna watch how they're breathing. So what I do before I even start the stopwatch, I get my phone ready to get ready to start. I look at her to follow her breathing pattern. Some people breathe a little bit slower, so you gotta at least get a good 2 breaths in, and then you can start. They're gonna time it for about 15 seconds. Now with 15 seconds, you're gonna time that by 4 to get it for a full minute. So she did 4 breaths per minute, well, per 15 seconds. I times that by 4 to get a full minute, and her respiration rate per minute is 16.
Does everybody understand that?
Yeah.
But
Our respiration is
So-
60 or 16.
16.
She's breathed
See?
1,
In other
2,
words, when you're
3,
doing, when you're
4.
watching somebody breathe, they go. You see? So you're gonna count the amount of times you see them breathing for 15 seconds. Then you multiply by 4, that will give you what it is a minute. So if she breathed 4 times in 15 seconds, you multiply it, that's what it is. So you're gonna put down 16 on your list of respiration.
Yeah.
16.
16.
I know.
Okay, so you're counting the amount. Some people are slow there.
Mhm.
So that person may be 12. Some people may be 20. So that's why you just got to get used to it. When they lay down, just kind of see how their pattern is. Then when you're ready to start, then you count on the next breath.
Does it have a normal range that you should be in?
It differs with age and with health issues. It's right now, you're not looking for normal, you're looking for whatever it is.
A shallow breather can be breathing 28, 30 breaths in 15 seconds because they could be nervous or whatever. But the thing is that normally we want, if it's a healthy person, normally it's between 12 to 20. Okay, that's a normal person.
But again, when you're
But-
taking vitals, you're taking it for what it
in the
is.
normal range.
You're not looking for normal, you're
Don't
looking
worry.
for whatever it is.
And I'll explain to you what you just said. Okay.
Sure, so we just took her laying down blood pressure, and we got 173/97 with a 67 pulse. Her
That's laying down.
laying down, and then her. You want to compare it. So when you lay down, your blood pressure should go down because you're relaxed. So her blood pressure on her right side was 186/90 with a 70 pulse. Therefore, when she laid down, it went down to 173/97.
Why did it go down?
That's it. Oh no, sorry. Anyway, when you lay down, you're more relaxed. So your blood pressure shouldn't be high while you're trying to lay down.
Okay, another reason. Yes, it should. When you're sitting up, and especially when you're standing up, remember your heart has to pump harder because you're in a different position.
Then after
But
stand
when
up.
you're laying down, all your
Then stand
organs,
up.
your heart is on the same level as your body. And so therefore it should go down. Now,
You mean it should go up when you
I
stand
mean,
up?
no, when. Are you doing standing up? Why are you taking so long?
Take a blood pressure.
Take the blood pressure. As soon as they get up.
Yeah.
Keep still, Leonard, keep still. No, you move, no, you move.
Never lay down again. Never lay
Right.
down.
And the answer she's dizzy.
Yeah.
Right, that's what she
As
was
soon
doing.
as
but
soon
she-
as soon as the
as soon
person
as they
stands
happen.
up.
So just wait. Let
Now
me finish.
explain to
explaining.
what should happen.
Okay, just wait. When you're laying down, your heart's on the same level. Everything is on the same level. Unlike when you're sitting down or you're standing up, the heart has to pump. It should not pump that hard when everything is on the same level. You understand? Okay, now when she's gonna stand up, all of a sudden from this level to that level, the heart's gonna say, "Oh, standing up position." So it has to pump harder because she's now in a vertical position.
And why do you ask the person's
Okay. And so so she's gonna ask, when you got up, I mean, not that you're gonna, but
Some
some
people
people
put
will
it-
stand still, but they feel dizzy
or lightheaded?
or lightheaded. Okay, so that means that there's an issue there. So let her relax
No,
a minute.
Just a little caution. They can be lightheaded for maybe less than 10 seconds. It's less than 10 seconds. It's not so bad. Just tells me the heart is not pumping as efficiently as it should. And then that will tell me if they're exercising or they're not exercising. It gives me a lot of indications of what's going on with a person. So that's why you have to ask that question when they stand up. Are you lightheaded or dizzy? And say like this, then I'm timing them to see how long that lightheadedness or dizziness goes away. If it's less than 10 seconds, it's not so bad. It just tells me that their heart is weak. If they're still dizzy after 10 seconds, it's a problem.
Now, I always heard before where sometimes if you get up at a certain time, people have had heart attacks during the night when they've gotten up too fast.
Right.
Does that have any bearing on
Yeah,
what you're saying?
it can have.
Because
Yeah,
there's health issues
there's
there,
definitely health
obviously.
issues there, and nobody's picked it up. They're just, oh, this is normal. I've been doing this for most of my adult life, or whatever they say, or it's just been happening the last 5 years. They don't realize what they're putting themselves into, and they could collapse and they could have a heart attack or a stroke
Right.
or die right there.
Okay, so try
Getting
it.
up too fast. I heard
Right.
too.
Okay,
You're gonna actually stand up.
you cannot help somebody stand up. They have to do it on their own.
Right.
And they keep very still. Ask her.
All right. Are you lightheaded or dizzy when you stood up? All right, then just hold still.
Now, are you holding her because she's not steady?
Oh, wow.
It's just habit.
Yeah, it's just a habit. I
Well,
tend
some
to do,
people
but some
say,
people will end
I'm
up
okay.
shaking
Some
after.
people say I'm okay, and they'll fall over. It's just that. Just to hold them, just in case.
Or you just did it now?
No, it's an error. I think.
Oh, she moved her hand. That's why.
Oh, okay.
If you move your hand, this is so sensitive. This particular one is so sensitive. If you move your hand even slightly, it's going to give an error. So she can
Why'd
press
you
it
do
again.
It wasn't starting.
Stop moving.
Yeah.
Don't look
If the
down.
person-
Shake.
If the person moves, then it's gonna give you an error message, so you have to do it again.
Right.
You can't fake a blood pressure.
You have to lie down again for it to.
Yeah, she keeps getting an error. Yeah.
Oh.
If she doesn't, if you can't get the reading in less than 30 seconds, then she got to lay down.
Now, it's gonna be a little harder to do it this way if you had the manual and you had to pump.
All right.
Okay.
You
Can
can sit down.
take a seat.
What's the number?
So her standing blood pressure was 154 over 89 with a 71 pulse.
What was it when she was laying down?
One laying down is 173 over 97, 67 pulse.
Okay, so 150 what?
171. 173 over
And
97.
then standing up, it was
67,
154?
154.
Okay, now, that shouldn't be.
It's going opposite. Right?
Exactly.
Can take a seat.
Exactly. Who wants to comment on that?
Can't connect that down.
Connect the dots.
Is it
Take a guess.
171
lying down,
laying down, 154
standing up?
standing up.
Oh,
I'm gonna take your
not
temperature
getting
and
enough.
it's out of here.
Yeah, blood to flow to the brain or something like that.
It's not catching up. When it's much lower than the laying down, first of all, the laying down was high. What was it comparing to the two arms?
It was about in between. It was in between the two arms.
In between the two arms. So her pressure's like all over the place. All over the place. And it shouldn't be. When you're laying down, it should be lower. When you stand up, it should go higher. And it's the opposite. If it's like that on a regular basis, they call that orthostatic hypotension. Okay, because ideally, again, I'm relaxing, all of a sudden I'm going up. It needs to pump harder to do that. If anything, it went down. So there could be many causes. Again, the lack of water. There's other things that may be going on.
Lack of rest.
Okay, lack of rest. So ideally, and then if it's that different, what was the difference in the two on the arms?
Left and right, 186 on the systolic on the right, 171 on the left. And
Okay, that's too much of a difference between both arms.
pretty close.
So one of the it should be pretty close. One of the things that when you're taking a pressure and it's that off, connect the dots. Stop and think. Why is one and the other one it's higher than normal, but why is it that much difference?
The circulation is not there, right?
Exactly. Something up with the circulation. It
Which
could be
is the heart, which is
something going on. It could be formation of calcification, or in other words, it could be it's slower on the whatever arm is the lowest. It could be the beginnings of a clot. It could be a number of things, but you should be regular, almost. If it's off by a couple of little points, no big deal. But that was 186 over 171, something like that,
15
or whatever it was. That's too much. Okay, and then she's high when she's laying, and when she stands up, it's lower. There's stuff going on with her. It shouldn't be like that. Hard to say until you do more exams.
So for now, let's look at her numbers. And she's a good person because now we're talking about her.
Okay, can you bring the camera back up here?
But you know, Jerry, this kind of answers the question that I asked you when I was at your house.
Right.
Because I thought that majority of people who had the high blood pressure were big people.
No,
This, answers
Yeah.
it,
right.
That's my
So-
dog.
Don't assume that to a point, assume that if a person is overweight and older, assume in your mind until you actually take it. But don't assume a person who is thin doesn't have any health issues, because a lot of people do. And this is a case. She's thin, but look at some of the issues that she has.
Can I ask you a question?
Yes.
Have you been feeling any health problems that you as your body that you feel normal lately?
The feet, the legs, the legs, bad.
Check it out with the doctors to find out what's going on.
Or even before that, what is it that you were feeling?
Dizzy.
From your knee is dizzy?
Other than you're talking about,
Or whatever, your foot, your leg, whatever you were pointing to.
oh, it feel like tired-ish.
Tired, your leg is tired.
Yeah, feel
Okay.
tired-ish.
Okay.
When you walk in, feel like kind of tired-ish, and then a stiffness like behind you.
Mm.
Okay.
And if I sit down and to get up,
Mm.
because if I'm train or anything to get up, a lot of pain and
Pain in the back of the knee.
yeah, and
So what does that sound like? Muscular?
I,
A what?
I don't want to say it because I don't want to say it.
No.
It's, I will go to the doctor.
sound like what happened to me the last time, but I felt like I was getting a stroke.
Okay, DVT. Deep vein thrombosis.
That's-
PAD also?
Yeah, well, it can be, but because of where she's
Yeah,
saying
leg.
it is,
The leg.
yeah,
Peripheral artery disease.
yeah,
happens
but
that way.
but
My
it
bad.
where it was what back here,
The
down,
back.
Yeah,
Yep,
like in
that's it.
there.
that's a major
Yeah.
one.
So it could be the formation of a clot. I mean, she's doing this in public.
Why
So
don't everybody come up closer? Just come a little closer.
bring your
I
chairs
put some
like up
numbers
here,
out there,
but
and I just want to
especially Miss
explain.
Clotilda.
From there.
All right, so
Bring your chair. Bring your chair.
So now, actually, she's a good candidate because all right, so she's a good candidate. You just now, I want you to pay attention to this because it's important. Because if you're gonna see a lot of people in this condition, you really are. You're gonna see a lot of people in this condition, and you're gonna have to interpret what's going on. And truth be told, if you're doing this and you say, oh, everything's okay, then something's wrong. Because what you want to see now, when you look at the numbers, 186 over 90, what is, that's why I wanted to come closer. 186 over 90 on the right side, and 171 over 87 on the left side. What are you going to tell that person? What are you going to tell that person? Sorry.
It's fine. It's okay.
Saying that it's your precious time.
All right, so when you see 186 over 90, is it high or normal?
High,
How high?
very high.
Very high.
Yes.
When you see left side 171 over 87, 75, what is that?
Still high.
What's high?
Very high. Which one? One.
What is high?
What at the top? The systolic is high.
Systolic is high.
Yes.
Why, if this is, so let's say this was normal and this was high, would that still be considered high?
Yes.
90 is high? Absolutely.
Yes, 90.
Anything over
80.
90 and over is high blood pressure. Whether it's the systolic or the diastolic. This is a diastolic, this is a systolic, and they should be both. This should be below 90, this should be below 140.
You're already high if you're at 140,
Yeah.
so that's really high.
Right, so you understand what I'm saying? And so this is important to understand when you're taking people's blood pressure. That's why you have to let them sit for at least 5 minutes before you take their blood pressure. If I just came in and I just sat down right and you start taking my blood pressure, it's going in most cases it's going to be hard unless you're an athlete. Because I can be an athlete and you say I could walk around and you could take my blood pressure and I'd still be normal. You understand what I'm saying? I can prove it to you. But the point is, this is the problem. Now she's laying down, and then she's standing up. Let's do the laying down. You compare this number and this number to this number. It should be high or it should be low?
Should be low.
It should be lower.
Yeah.
Why?
Because
Your body's at rest.
The body's at rest. As my wife was saying, you're laying down, you're calm. You understand what I'm saying? So everything should be lower. But where is it? It's still high. It's higher than what she was sitting on this one. And she took this on the left side, right?
Yeah.
So look what happened. Left. So there's a problem with her heart. Yes.
Why you wait 5 minutes to sit down? Is to bring the body in some kind of rest before.
Yes.
Yeah. She could be rushing in and you're taking a reading when the heart is still pumping hard to get her where she's going. So you want her to be sitting down.
Bring the body to a rest.
So you rest, yeah. Talk to her, calm her down, you know. Now let me say this to you, and Jimmy, I'm going to talk a little bit about you.
Yeah.
If I talk to you about something that gets you angry, upset, where's the blood pressure going to be? It's going to be higher than why? Why is it going to be higher?
Because you're angry.
And what does that do?
Stress.
Put stress in the heart. So you gotta, and so this is why when I'm talking to this lady, I said, you know what? I'm gonna talk to her in a nice, calm way. Guess what? I'm calming her down. But I want to say, you know what? How do you and your husband going on? And her, she's having trouble with her husband. What do you think is gonna happen?
well, that's mine too, is it?
You understand what I'm saying? No, I don't know her. I don't know her story. So if that's happening, I don't know. But, he's good. All right. Good. So her pressure should be going down. Yes. If he's good, her pressure's not going to go up. So that's what we're talking about when we do this.
Question.
Yeah.
So I noticed. So is it important to write probably initial R for laying down or L for left when you do this? So you could do the comparison.
Normally, when we do the left, their hand is automatically on the left side when we have them stand up. Normally. And that's how we do it in my place. Because you're laying down, and that hand, the left hand is on the outside of my office.
Yeah, you always do it that way.
Right.
Yes.
And you know why you want to do the left? Because where's the heart leans to more towards? The left side. So you want to do the left side. Yeah, Jimmy.
Okay, but what I do notice also was that her pulse is close, left and right. 70 and 75 is not that far off.
And 67, 78. So is that good pulse or bad
Also
pulse?
with the sitting. The sitting.
The sitting is 70 and 75. And then
Right.
when she's laying down, it went down to what? 67.
Oh, okay, that's different. Yeah, I couldn't
So I could tell her pulse is doing hard. Her heart is actually doing well. It's beating well. But the blood pressure is not doing well.
So the heart can beat well, but how can the heart beat well if the heart is not doing its job?
Good question. Now, as Anna says, you connecting the dots. That's what you have to understand. That's how you have to interpolate. How come the blood pressure is, the pulse rate is good, but the heart is high blood pressure? Now you got to say, well, the diagnostic tool.
Which one did you point to?
But the first one I'd go to is
Water.
water.
Do you like drinking a lot of water? Does she drink
You drink water?
a lot?
How many bottles a day?
I drink it from the top.
To what?
How many cups
How many bottles?
This side.
Yeah, how many?
This side.
That's how we
Yeah, I
compare it
drink
to.
How many?
One of that, sometimes I drink just two probably.
Now,
And
now,
there's a-
you weigh her, how much should she be drinking?
I don't know what she weighs.
Let's say
Oh.
she's about 135.
130, yeah.
Go weigh yourself, sister.
Tough.
Where's the scale?
It's over-
Well,
right there by the-
even without the weight, Jerry, according to what
Bring
you're
it
supposed
in,
to,
bring it
2
in.
bottles is still not enough.
Oh, you gonna move it up?
Yeah.
So you're gonna take off your shoes, and if there's anything in your pockets, you're gonna take it out.
I'll hold the money.
All right. Anybody notice how she's walking, by the way?
Yeah, she has.
Everything you have to observe.
Yeah,
She has a pain in her line, that's it.
All right.
It's really bothering.
And then you have to ask her what's going on.
Yeah.
You see, I don't let anything go by. I'm watching every little thing she does. Just kidding.
Oh,
But not yet. Not yet. Till it goes zero.
You have to hit the end, the middle, not the gray, right there where your fingers were. When the
Well,
numbers
no,
come
no,
up, hit
stand
it
up.
with, yeah. Keep still, look up, straight, don't
145.
move.
It's 133.
All right, take a seat.
Get her high. Get her high. Get her high.
Oh, come. We're gonna let it do it.
Her thing is
No, remember that
Then
thing.
I'm looking
All right,
behind
you're
you.
gonna get-
Put your hand there, don't look, put your hand there.
an average. What is it?
All right, so that,
Step away.
64 inches.
5 feet 4 inches.
It's fine.
Close.
5'4"?
Yeah, 5'4".
5'4".
Okay. All right. I
Can
want
I-
her to walk. I want her to walk.
Wait, before you do that. So remember what I mentioned about the standing up being lower? Can you read what orthostatic hypotension? Because when it goes down instead of going up, what are the symptoms?
Causes that aren't due to
Speak loud.
can have causes that aren't due to underlying disease. Examples include dehydration, standing up too quickly, medication side effects, or aging.
What else? There's more.
I have here, it says orthostatic hypertension is a form of low blood pressure caused by blood vessels failing to constrict when the body takes an upright position.
Mhm.
It's usually a symptom of underlying disorder
Right,
rather than a disease itself.
correct. Okay, so it could be, okay, so you
It
have an
increases with
idea.
age.
Yeah.
So
So what was the first one that Chris said? Dehydration.
you know that water would correct a lot of health issues.
A big time, big time.
And this is it.
From the top,
You know what?
like when I drink from the top, I drink a lot.
From the
Oh, the
tap.
So
tap.
how
Yeah,
many,
from the
Tap
top,
water.
yeah, I drink more.
to compare that to
Yes.
a cup or a bottle? So
But
how
the
many
more water
total?
you drink is the more perspiration, right?
Yes.
And the more perspiration is
Usually.
You
Usually.
detox it, yes.
I don't think you have to walk around sweating.
Because all the
You
perspiration.
have
I'm
issues.
sorry.
That's not good.
Because most likely you don't drink enough
That's
water.
not
I'm not.
I
If you sweat, if you drink a lot of water and you're still not sweating, there's something going on.
It should be.
See, he just said it. Say that again, Jerry.
Wow.
When you're not,
I said if you're
sweating.
drinking adequate amount of water,
and you're
you're
not
close to your
sweating.
body weight ounces, and you're still not sweating, there's something else that's going on.
Even if you're not
That's it.
active during
Even
the
if you're
day.
not active.
So if you're not active, you should be still sweating.
Oh, but you two, there's a difference
But
between
you
under here and then
sweat
sweating here.
automatically.
Yeah.
You're not sweating.
That's going to be a good indication of how much, if you're
No,
sweating a
that's
lot,
good.
profusely, that means that
That's
maybe
okay.
that you're not drinking enough water.
But I
You
know you
understand?
drink enough water and I don't see you sweat.
come run with me next time.
No, but he said this question was,
Yeah.
No,
even when you're not.
And
Yeah,
I
if I'm
answered
a-
this question while you were talking.
If I'm more at rest, I won't sweat.
That's what I,
Yeah.
okay.
Uh-huh.
All right, do you understand this part of it? Now she's 133. Her height is 5'4". Let's do it. Take her BMI
Oh.
and then take her oxygen level. So what you're looking at is this.
Get your
Yes.
calculator out.
Oh, you can sit down.
Now, how much water should she be drinking if
That's
she's
what we're gonna
134?
figure out. Half of 133 is what?
You have a 134.
66.5. Divide that by 16.9.
Divided by 16,
Just say
0.9.
16. Now. Just
Jerry?
divide by 16.
7 was
3.93.
We're gonna reflect the BMI.
You need to.
We're gonna
do
reflect the
four
BMI on the screen.
bottles.
Got it?
Right.
Okay.
So Rhonda,
Yes, please.
you need to drink 4 bottles a day.
She's 5'4".
Yeah, because it's hard from the tap. I don't know how much, you know what size cups you are. So this is this. But
133.
if you are carrying this around, obviously that's more than
That's a
66.
that would be a quart.
That's
One quart.
a
So
quart,
you have 4 quarts in that. 2 pints per quart.
half your weight
So divide, okay, half the weight.
by this size, if you're using this size.
So once you get half the
Four
weight,
of them.
then you do, let's say 89, and you divide it by
Okay, so,
16.9.
Yeah. Or if.
Okay, now
that
she's gonna
bottle's
do
not
it.
16.9, that's
All right.
32. So then
Understand,
you
huh?
divide it by
She could sit
32,
down. You gotta sit.
that's
You gotta be
how
still if you're gonna
that
sit
size.
down.
Whatever size.
Yeah, I do 16.9.
So you're gonna
because
give
then
me
that tells me I
this
need
part?
5 of those bottles a day.
Of your thumb. The palm is gonna cover the whole metal bracket, and your thumb is gonna
Just
go
focus
over
on
like
what she's
that.
doing because you guys are going to be doing
So
it. Maybe it's not going to
palm
be
of the
today.
bracket,
It's going to be
both
next
on both
time. we
sides.
meet. But we're going to spend a
So
you're
whole
gonna put-
morning on this.
Hold on, hold on.
We're going to spend a whole morning. 'cause You're from your
You're making her
Yours
twist
gonna
her
be
body, don't do that.
your.
In front of you.
Talk to her in front.
Okay,
Okay, there you go.
So we next time we
And you're
come,
gonna
we'll
extend
spend
your
the
elbows.
entire day doing this.
Straight.
Whatever it's gonna do. I want to leave your papers there. Do not take them
And
home unless you
then
want.
let's
If you
start.
promise you take them home, bring them back filled out. You should have already filled them out.
Okay, you watching the meter? Oh, there it is.
Alright, you can relax. Let go.
Let go.
Go, let go. Yeah, I got the number.
Ease up, let go.
Right.
Let it go.
What's the number?
Okay,
So
record it
her-
before it goes away.
Her BMI is 22.8. And her fat percentage
Was it 22?
22.8. And her fat percentage is 31.5.
Is what?
31.
31.5.
Okay. All right. Now we got some numbers, right? Now you're gonna have to give her a health assessment, tell her what she needs to do. We're not gonna do all this work on her and just say goodbye. You gotta tell her now what she's gotta do. All right, now in this chart, it's gonna give her some instructions of what she has to do when she goes home.
Drink more water.
So you're gonna fill it out
Number
for her.
1.
All right.
Yes, please.
But your organs are thirsty. Your organs are
That's
thirsty.
okay.
You gotta drink it even if you don't like it.
All right. We got some numbers now to work with.
Jerry,
Yes.
I've been listening to Sister Jordan coming in, and she's been complaining about this for more than 2 weeks, if my mind serves me right.
Right.
In my little brain, I would like her to probably go to the emergency room at Kings County and get checked out what is happening in the legs. You don't take that for granted because she have been having this pain constant and could hardly walk.
Okay.
And that is not
All
a
right.
thing.
Hear
I would
me
take.
out before you run people to the hospital.
2 weeks. Mm-mm.
Sister Jordan.
You know, because
No, hear me out. I'm not saying that she shouldn't go. Number one,
seen
her blood
people-
pressure is high. Wait.
Yeah.
Yeah. Her blood pressure is high. This is why we're doing a health assessment.
Yeah.
Her blood pressure is high. Her when she's laying down is high, so that's an indication. She could have a stroke. She could have any kind of problem. If her leg is hurting her, or if her right arm is tingling, what's that telling you?
Heart attack.
Possible heart attack or stroke.
Or the jaw.
Possible. You're not a doctor. You can't diagnose.
No.
Right.
All right, now lay down. Lay down.
Move that,
Oh, grab
move
the
that out the way
pulse.
behind you.
Now, you said her leg is what? Which leg? What's wrong with the leg? Stiff, okay. Okay.
And then sometimes I on the ground. And I end up drop sleep on the ground.
It just falls asleep on you?
On the foot.
Yeah.
Not regular.
No, you said you have a pain if you sit down too much and you get up, you have a pain? Okay.
Now, what leg is it?
Right.
What leg is he pointing to?
Right.
Pointing her right.
Okay. Point to the right leg. Okay.
Her left.
All right. So now, before you rush somebody to the hospital, you gotta ask more questions. Do you have any back pains?
Sometimes.
Where in the back?
Mid, lower, top.
All right.
And then I get to the palm.
When she gets it, she what?
Can't move.
Can't move. You see, you can't just say we have experience. I'm not saying that Stefan is not wrong to say let's go, because if you don't know what's going on, send her to the hospital. But you got if you know that you can go beyond the normal what normal people see. She could be a problem with the muscle, and a muscle contraction. It could be a problem where the spine is.
Yeah, right.
You understand?
Vertebra.
So there's things that I need to ask her. Did you fall? Have you fallen lately? Did you fall?
To take a sleep, I'm not so sure. Not here, back home.
Back home. How long ago was this? What's a good while? What's a good while? Couple of years? Okay. So now you get more detail on what's going on. All right. This is so important. Do not be afraid to ask questions. I saw her walking in a bad way. And I did not ignore it. I'm gonna, when at the appropriate time, after I've done all the vitals that I've done, now I'm gonna ask her questions. Now, let me say this to you. What Stefan says, if you don't know what's going on, she had a fall a couple of years ago and she never addressed it. So now I'm going to do something just to get a feel for what she's doing. I want you to tell me how much pain you're under. Wait, I didn't tell you yet. Does it hurt? How much? How much does it hurt?
Oh.
Where does it hurt? Right on these? Calm down. All right. Turn around. Lay on the stomach, put your face there. Take the glasses off. Which face up there? You have tissue? Anybody got tissue?
Got them wipes, right?
I have tissue.
No,
Where's the alcohol wipes?
Empty box, empty tissue box, yeah. They have more.
Yes, I do.
Let's get one of the alcohol wipes.
Two paper towels.
Jerry, that alcohol
Each
wipe?
side of the face.
Yeah, you got dedicated towels.
Wait,
I want
paper
someone to
towels.
Paper towels.
Hold on.
Now this is advanced stuff. So I'm going to go into advanced.
Each side to cover the cheek. Another piece. Yeah, there you go. Break it up, break it up. You don't want her face in the paper. No should be free on each side.
Now, do you know, I have, she mentioned her lower back, is that correct?
Yeah.
Where in your lower back is the thing? What's that here? Why don't you come around?
Yeah.
If you want to see this, because I'm going to show this.
Go up, go up, everybody. Come on, David, you too.
So,
You're ready.
so did you go to the hospital when you fell down?
Oh, okay.
Hmm?
You know what? I feel good.
A vehicle bounced her.
Yeah, I'm just saying.
Well, she said she got hit by a car.
Hit by a car.
Okay.
It bounced her. Hit her.
Ah,
And did you just get up and start walking, or you were okay? You felt okay?
I didn't drop.
You didn't drop?
She didn't fall.
You didn't fall?
No, the guy laid off, he wasn't paying attention. So I was going back to the office and then he came up.
Okay. On the left side or the right side? On the right, okay.
was she in the car or was she out?
She was outside.
She was
Outside.
Yeah. And the car just hit
Just
her.
tapped her.
Didn't hit her hard, but hit her enough to
But
On
it
the
could
right.
have hit her enough to knock her out of alignment.
Yeah,
Mm.
do you understand?
that's true. Yeah.
Okay. So now the thing is this, did you go back to work after that? Huh?
Get a week off.
I didn't hear.
I get a week off.
You took a week off. What did you do in that week?
Like,
Hmm?
I lie down.
You lay down. Okay. So she didn't go to the hospital,
Yeah,
right?
I went to
Oh, you went to the hospital. And what did they say to you? You don't remember? Did they give you anything for the pain? Huh?
no.
What did you take for the pain? And are you still taking it?
I didn't do
She didn't take anything for the pain, but they gave her something for the pain. Is that correct?
Yeah.
Okay. And all right, so now we know that the problem is on the right side. Now there's a lot of information in that area. All right. So because you never addressed it properly, there's a lot of information on that side. And now we got to determine where the information is. And most likely, like Anna said, she got hit here, right? Right here, but she never addressed it. The hospital didn't find anything. Didn't find anything. So,
See, the hospital is looking for something broken. If it isn't, they're gonna just give you something for the pain and that's it. But again, it's like a black and blue. Is a black and blue broken? Not all the time, obviously. When you fall down, you'll get black and blue, but you won't get a broken bone per se, unless you have bone issues. So, you know, you're older or whatever. But again, if she was hit, this ever so slightly, it could have moved her pelvic area, her bones, her hip. And then ever since then, since it wasn't addressed properly, because you don't see anything obvious or feel anything that obvious, then you're gonna live with that pain, and you're gonna live with the fact that it just moved slightly, ever so slightly. But that slight movement can affect your hips, your whole entire spinal cord.
And two things. One thing you said before about the cigarette doesn't affect you,
Right,
but what happens is you're probably, you're trying to live with it,
that's right.
but then
And you aggravate it.
right, you're aggravating the cause problem. Did she get an X-ray?
did you get next?
No.
No,
No.
They said it
but you went to the
muscle-
hospital.
Oh,
But they're not gonna take an X-ray unless
What's that?
she was in
Said that the
dire
muscle
pain.
pump.
She said the muscle what?
There's a pong on it, like a hit.
Oh, yeah. So so what's happening? There's nerves that run along the entire body. And what's happening? She still almost has inflammation that has never, and there has been some blood clot in that area. All right. So the point is that now so in order to address this, we have to release the blood clot, and have some tools at home that we can use to help to do that.
Well, it depends on how tight it is. That area can be massaged. But what's even more important is if you're gonna go do a massage, you must
So
drink lots of water, do the massage, and then even more water after massage.
right. So even when you're doing a treatment that I would like to do on her, she has to drink the water before and after.
If you want to prevent blood clots from
Correct.
traveling.
And the inflammation is here, it's pressing against the nerve, and so she's not able to move it. The hospital won't pick that up.
And another thing that Jimmy mentioned, that it happened maybe over time, and you mentioned it too, Jerry, what happens?
Right.
Your body will adjust to any kind of accident if you don't correct the issue at the time. So, I mean, your body gets adjusted to anything that you push it to do, even though it's not normal. So if she didn't get it corrected and if they only gave her something for pain, and she's walking at an angle, but nobody notices that angle, the body's going to get used to that for years until something else happens. And then all of a sudden, so what happens to the part where, if they're twisted, that side of the muscles are going to tighten up and shorten, so that when it's time for a therapy or something and you try to straighten it out, yeah, at first maybe, but they'll automatically go back to that side, because for so many years I've been walking like this and didn't realize it. So you have to get constant massaging. You have to do hot and cold treatments and stuff to loosen it up and give it a chance to become normal again, because the muscle has been so used to this for so long. So in her case, it didn't happen last week. It happened how long ago?
She said you.
A couple of years ago.
2 or 3 years ago. So the muscles have gotten used to the wrong way. So after a while, with age and the fact that it's not meant to be walking that way, when it's time to massage it on a regular basis and use hydrotherapy, it's going to take a while before you actually straighten out.
All right, so let me show you. This is advanced therapy. This is something that I'm still getting used to doing it. But the thing is that I'm going to lift the shirt up a little bit, okay? So now, this is our spine, right? So what you're going to do, just relax, okay? There we go.
Oh,
all right.
Jimmy. Howard.
What did she just say?
Ouch.
Okay. So that's
because what he's doing in of itself should not hurt.
It shouldn't hurt, right?
No.
So that means something's wrong there.
Exactly. How come she didn't say ouch out? It's only ouch on one side.
Did she say ouch that time?
No.
All right. Sit up and turn around. Roll over.
She's gonna run out of here now.
All right. Now, remember what I did? How far did I go?
Second and fourth Sunday, we have healing in this church.
Does it hurt?
Oh.
All right. Any pain?
Oh,
Thank
wow.
you, Jesus. Thank you, Jesus. Oh my God.
Now walk.
No, get off the table and
Let us see her walk now. Guys, take a back.
come walk down this way.
In style.
But listen, it may come back.
And you have to drink water.
You have to, yes, drink water. Drink water like now.
Let me see what you did. I was
Drink water.
You share the video, see.
But listen, it takes time. It does take time, folks. It may have worked temporarily, But this is not a cure. Remember, she's been like, if it has happened, that's different. But 2 years, something like that. So it may start to hurt again. Okay, so I'm just saying that when something has been around for a while, it's good to feel relief, but that doesn't mean the muscles are used to it.
Right.
Right, and the
Okay.
point is that the water's key, resting, you know. So when I
Water is
pushed her
key.
leg up halfway, she was already feeling the pain.
Drink. Where's your
So
water?
so now we did a slight adjustment on the pelvic area. That's all we did. All right, nothing magical, but the muscle was stretched and they weren't, and they've had problems with the muscles.
Would it also help her with what you did and what you said, soaking in Epsom?
Yes, it would be good for her to go home now and soak.
So, this is it.
This
For
is
the
an
situation.
example of hydrotherapy would help. So seeing that it's here, you can't do it, Jimmy, you can't do, she would have, in order to do an Epsom, you have to sit in the tub where the water, your legs are gonna be out. So you sit in a tub where the water reaches to wherever, up
cover it
to
up.
here or something like that.
Oh, wow.
So how many
Warm
people,
water
how many
with
people do you think
Epsom
can
in it.
help by knowing what we're doing?
If they
A
have
lot
that
of
same
people,
mind,
right?
Yeah.
Yes.
Just go like this.
My brother was ready to go to take her to the hospital. What were you gonna
I don't let. No, it's not about stress and Charlotte. I have known people die from thrombosis of the leg.
Yes.
And if I don't have an X-ray vision, and this has been going on for 2 weeks. So for me, you go there, clear all
And then come
signs,
back
and
and
then
do the
come back,
therapy.
and then you do your treatment. You understand? That's in my head. It's about she's here in pain.
So
What do we do? For me, you're gonna go to the.
Talking about pain, folks, you can sit down.
go and drink.
Talking about pain.
You feeling good?
Yeah.
All right, so-
Take up your shoes and
Let's
walk.
get to the
Wait.
doctor.
So talking about pain. You can sit, David. You can sit, Clotilda.
They hit hallelujah, like hallelujah.
Okay. Pain will cause your blood pressure. Pain will cause your blood pressure to go up. So if I got a pain, no matter where, blood pain will cause in a lot of people their blood pressure to go up. Okay, so try taking your pressure.
Come on over, let me take
Let's
the
take
pressure.
the pressure.
Come back over here.
Does it
Yeah.
matter what type of pain? Let's
No,
say,
it doesn't.
let's say you've been working out and now you're, it's sore.
No, if you're working out, you should not be taking your blood pressure right there
No,
because
not
you're,
the blood pressure, but I'm saying, suppose I just started a regimen.
uh-huh.
Normally, when you do that, you come back the next day, maybe sore, can't do whatever. Does that qualify as pain? Or soreness.
No, that's more soreness.
Yeah.
Yeah, that's more soreness. But if I have pain because 3 months ago I broke my arm and it's just not quite the same and I'm constantly in pain and the doctor's giving me pain meds, but I'm still experiencing pain. Pain in a lot of people will cause the blood pressure to go up.
Gotcha.
Okay, so take that as you're doing an assessment. Remember, it's so important to ask all kinds of questions. All kinds of questions. Have you been in an accident? Okay, how long ago? 15 years ago. Well, you would think, yeah, that has nothing to do with it. Yes, connect the dots. For 15 years, she's been in and out of pain. Or I'm just exaggerating, but you understand what I mean? Asking questions is very important. So yes, the main assessment tool is what?
The laws of health.
The 8 laws of health. But that will lead. So the more questions you ask, the more then you'll be able to ask other questions not related to the 8 laws of health. I've had this pain. Okay, So that opens it up. How long have you had it? What's the intensity of the pain? When did it start? Was it a cause? Like in your case, a car or whatever. So you've got to learn to ask questions. Okay?
And it echo hard enough.
Huh?
When the vehicle,
Oh,
they
hit
make
you.
it echo hard.
It hit you hard.
Echo, it was a loud sound.
Sounds
The
loud.
sound was loud.
Oh, the sound.
When it
was-
hit, the sound was loud.
Every
Oh,
vehicle
oh,
is hard.
oh,
You didn't sue?
That's my country. You go get.
Now the thing is with this, is that the thing with this is that, listen, I could have done it and nothing could have happened.
Right.
You understand what I'm saying? Then it could be more severe. But why did I know which way to push it? Why didn't I just focus on the leg?
Because she was
Because she
describing where the pain was.
Yeah. You asked the questions.
I asked the question. Asking the right questions is the answer. And so I kept you I let you go 15 minutes early, so you gave me an extra 15 minutes this time. But the thing is that the point is, I wanted you to see that a little knowledge is a dangerous thing.
Yeah, you gotta be careful. Do
You gotta
not
be
do it
careful.
unless you know what to do.
If you don't know what you're doing, don't do it. And I agree with my brother there. I would go to the hospital, let him take x-rays. All right, so I just don't want to eliminate the hospital. No, I'm not doing that. What I am saying is that there are things that the hospital can do, will be able to do, which we cannot do. And so I'm on Zoom now, right? So I just want to let you know, don't take things for granted. Don't eliminate the doctors in the hospitals. They have their place and we have our place. And so I just want to be on the other side of the portion. Thank God. I'm going to give God the praise that helps correct the problem. Right. But she has some work to do when she goes home because the muscles have been like that for 2 years. More than 2 years. So the thing is that something as simple as that, and yet you have to know what you're doing.
And I agree with both. But now, unless she goes to the hospital and she demands to have certain tests,
Right.
if they don't see anything, like you
Right.
said, they're gonna just say, okay, well, here's a prescription
That's
for
it.
eyeball or so and so.
We're gonna give her
Right.
Take this or
Tylenol
whatever.
for the pain.
So you
That's
gotta
it.
almost demand, say, listen, I'm feeling this, and you know.
But you know what? There's people who don't have insurance, so they're not even gonna go.
Sure, because they gotta take it to another level and.
That's it. Now we're talking money, and I've been living with this pain for 2 years, so hey.
And there's a flip side to that. You go and there's a fund in the hospital you get money to get from. So you
Okay.
go there and you cry and you tell them and the bill is $3,000. This is what I can afford. You might pay $130 because there's all this money there.
I believe that.
In this case, I did it at King's County, so that's right.
Relax. Don't move. So you gotta drink more water than what you did, Martin.
Oh, okay. I didn't catch why you said that. Want to try mine?
Not this one.
Next to that.
Jerry?
The talking one?
Yeah.
What are
The black
oh,
one.
yeah.
Okay.
That's my wrist tape. Is that my wrist tape?
Let's take.
Yeah.
Take a good rest.
Did I show you my brother?
Yeah.
What's up with this? Read the batteries. Oh, yes. Now that's a definite fracture. That's a definite break, not a fracture.
Yeah,
Wow.
fracture breaking. But my concern is that
Let them get it back
That
through a cast.
Somewhere mine.
It should be casted, put in place and casted.
Jimmy, let me hear it, sir.
sitting on it. Give it to her.
Oh,
Yeah.
Slow.
she gave you a paper. I didn't see the list. I am not. So remember what I said when I was back there, that the car may hit her and accidentally did this? I mean, I'm making it noticeable, but it may have ever so slight enough to cause that kind of pain. And so it's used to it. You get used to anything in life. Okay, you really do when you think it's normal for you. And so now, what he did by pushing it down is kind of, a little. But she may still have some pain, and it may have a tendency to lean towards the way it's been because it's been so long.
Because it takes time too.
It takes time. It takes time. But I mean, ever so slightly. Okay. When you see people, have you seen people who are hunching over? Okay. They've put so much pressure on their spine that when it's time for them to straighten out, it actually hurts, but it can be done. No, go home.
Now,
No, you
Jerry,
need to drink the whole bottle of water.
somebody like her, does she benefit from this?
Oh, yeah, absolutely. Absolutely.
You want to put some in the water?
You put some in the water, yeah.
I'll let you do it.
What is that, Jimmy?
This is cayenne.
He's gonna give you some water.
Where did you get it?
I ordered it
What do you want? What do you
on
want?
eBay.
I tried my head was too much of it.
But now, this one is 180
Huh?
heating units, 180,000.
Yeah,
So
that's
the
what
hotter, I think the better.
Whoa.
Careful, what happened?
What?
Put your
You
foot.
trying to trip her
No.
up?
No, she didn't tie her shoes. She tripping her lace.
All right,
She
so.
has the water there.
So you missed me.
It's gonna be hot. Do you like hot stuff, sister?
This is your water.
There's 100,000 internet.
All right, so.
Close up.
Is it gonna be having anything for next week?
You leave it here. It's fine.
Leave everything as is?
Yeah.
No point taking it all home.
No, don't make no sense. What are you thinking about? Relax. All is well.
I don't want to mess you up. That's all.
No, it's fine.
All right, so any other final questions so we can go home?
There's a comment. It's just don't owe nothing, Charlotte. I'm saying yes. Any final question? I'm going to give a final thought. Do you mind? The comparing of the various.
Move
Yes,
this
yes.
way or this
Yeah.
way?
The comparing of the verse thing that you just taught us was good because I never understood why you did what you did, even though that was since last July. It's a good way to compare, you know, whether or not the person's having issues. And like a simple case like Sister Jordan, a simple thing as water, people look at water like, and especially if she's dehydrated, she needs to drink more so she could hydrate herself. And to make matters better, if she could get some mineralize her body, so that will help the water to get inside of the cell, so the body could use the water efficiently.
Water is powerful. Powerful. Rhonda, continue drinking the water.
Yes.
You got salt here?
Himalayan.
Oh, when you go home, yes, but I'm saying drink that water now. Don't sip it. Drink the whole thing.
What does it say?
Learn how water affects every aspect of your body's health. Study reveal that adequate hydration can lower high blood pressure, lower high blood sugar, and assist the body in toxic and waste removal.
Right. So just that simple. That's water could solve a lot of
Health issues.
health issues. Thank you.
So
we
how many-
see that.
Did you tell her, I know you probably did, how many bottles she
We just-
needs a day?
Yes,
Augusta's taking care of it right now.
four.
Four.
Augusta is actually, we wrote out some
Oh,
things.
okay.
So Augusta and I explained to her exactly what she has to do. I wouldn't dump people like that.
No, I know, but you do, doing a lot. That's what I was, that's Anna's job, where you leave off.
Right. Okay, folks, let's stand for prayer.
Okay.
Now it's time to say goodnight to all the family. Okay. Who would like to have the honor of talking to the Lord? Go ahead, Halima.
Dear Jesus, thank you for this class to teach us how to take care of others and for ourselves. I hope that people learn some good things and 7 of the 8 laws of health. And I hope nutrition is also good too. Thank you for letting us wake up today. In Jesus' name, amen.
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 Amen. Amen.
Did I know I was gonna do anything like that? You mean it now? Never know what you're gonna run